Okay, we're going to give you an example of how to handle mastitis. So, what we really want to do is come up with some sort of system that we're going to have in place, our standard operating procedures, how we're going to handle mastitis on our farm. Given what we learn over these 2 weeks, the rest of the semester, we should be able to come up with something or a system that is going to save us money in some way, shape, or form. So, using our brain, we can save some money, possibly save some cows. We need to think about a system that allows accommodations to the specific bacteria. If we do that, we can have more success. Here's an example. You've got that in your printouts. We'll take a closer look at it. So we have a clinical mastitis protocol. So if we see something that is clinical, it's showing either as a one or abnormal milk or two abnormal milk affected udder. So the animal is not yet sick. So flow chart, we're coming down here. We've got a one versus a two. The recommendation for day one and day two, intramammary therapy. So that is one option that we might approach. We sample the animal before we do the intramammary therapy, and then based on the growth, if we've got um, no bacterial ID or gram positive, we might treat with intermammary as appropriate. If it's got gram negative, we know that the most of the intramammary treatments are for gram positives, so that doesn't work. We need to think about our JVAC program. Uh, we're going to let that animal cure herself as she moves through. So if we got milk in the udder involved, we're going to think about intermammary therapy and anti-inflammatory response or treatment for the udder. Again, we're going to take that sample, we're going to plate it, we're going to try to get results. Once we have results, we're going to act accordingly. So a little bit more aggressive on the cow side, no real difference here with the treatments given our gram stain results. So we continue down on the flow chart. If the animal is sick, she's got a fever, so her body is involved, her milk is involved, and the udder is involved. So we've got a three here. Um, we start with a physical exam, possibly intramammary. Doesn't probably help us. We may do something across the whole body. Certainly the anti-inflammatory. We can do supportive treatments, calcium, she needs it. Hypertonic saline is a great way to get out of this. That's day one. If day two she looks still sick, we're going to be more aggressive in our treatment. If she looks okay on day two, we may consider that intramammary therapy, antibiotics for the whole body. Day three, when our results come back, if there's no growth on our plate, we assume it was coliform. So again, sampling right up here. So we probably should have that in there before we do any antibiotic treatment. We want to get a sample. So we're going to assume coliform. We're going to get rid of the penicillin treatment. We're going to treat her symptoms. Gram negative, we're going to keep treating her body. We got to evaluate the J5. We're looking at coliform. We're thinking about E. coli, Klebsiella. If you got gram positive, you may go through and make sure that you have a penicillin-based thing to treat. But again, people are moving away from the antibiotics and thinking about treatment, frequent milk out, making sure that she's got all the supportive nutrition, all the supportive non antibiotic related therapies that you can bring to bear. So This is a flow chart. What you do in depending on what type of uh, mastitis you have, either identifying it as a 1, 2, 3, and then what do you do when your results come back in a day or two to continue on. So each cow, we work through the flow chart. We do the things that are appropriate for her based on what we see. So again, this is not a one size fits all. We do the same thing every time. We try to adjust to what we've got and what's there. Is another way to kind of isolate things out, try to figure out what you got. So this is another approach. This is more the sample side. What do we do moving through? We've got a mastitis cow. We do a physical exam. Is she clinical? Is she a 1, 2, or 3? Or is she subclinical where we're seeing elevated somatic cell, but that's it? So CMT score is going to pick that up, but the milk itself looks normal with no clots, flakes, or discolorations. With that cow, we're going to take a sample, and there's a number of different ways we can go to sort through and identify which animals, which microbes that we have. If you do a triplate, you're going to have this, and this auger already there based on what you see on those plates. You're going to identify strep bag, strep species, Staph aureus, staph species, different plates, coliform or no growth. So you have a auger that's specifically designed to bring out your coliforms. If you identify those, you're going to do no antibiotics. You're going to treat her symptoms, and hopefully she will spontaneously recover. If you've got animals over here, you are going to be testing positive for those. If they do grow, this is an opportunity to possibly treat. Staph aureus, we've got intermammary treatment, one way, shape, or form. So you're dealing with penicillin based there, but we have a sequence of events that brings in both what does the milk look like and then how do we identify the animal. So you could sort of see how this is a little bit more specific than the previous one, but more the previous one is more general but covers more of the options that you're going to run into. So we'll talk about triplates probably next week.